Today I'll be inserting an NG tube into my patient. The first thing I would do is verify my order, and I would justify the rationale as to why my patient were receiving an NG. Then I would gather all my supplies. I would enter the patient's room, perform hand hygiene. I would don my gloves and provide patient privacy. Now I'm going to measure the tube. I'm going to start with the end of the tube at the tip of the nose, go to the earlobe, and then down to the xiphoid process. So I would landmark the xiphoid process, and then I would mark that point with some tape, and that will be how far I'm advancing my NG tube. I'm going to sit my patient up in high Fowler's position, and then I'm going to determine which nair I'm going to use for the procedure. And to do that, I would first ask if the patient has any history of deviated septum or a broken nose, and then I would visually inspect it. And then I would check for patency by occluding each nostril, and I would select whichever one was more patent. So I'm going to place the tube into the right nostril. First, I'm going to provide the patient with an emesis basin, just in case they were to vomit, maybe provided chucks. And then I'm going to use some lubricant and lubricate the first 3 to 4 inches of the tube. And then I'm going to begin inserting. I'm going to monitor my patient for signs of respiratory distress or, emesis. I'm going to slowly advance it. Right now their head is in an upright position. And if I'm meeting any resistance, I'm just going to give it the tube a 180-degree turn. Once I see that the tube has reached the nasopharynx, I'm going to then instruct my patient to take some sips of water if appropriate, put their chin down toward their chest so that they don't breathe the tube into their lungs. The swallowing helps guide the tube to where it has to go. And then with their head down, I'm going to continue to slowly advance until I reach where I marked with the tape. Okay. I'm meeting some resistance, but I would go to where my tape is marked. I would have the patient open their mouth and make sure it's not coiled in the back of their throat, and then I would secure the device with a piece of tape or a securement device. Place the tape on the nose. And wrap the tape around the tube to ensure that it stays put. I would secure the device to the gown with a safety pin, and then I would want to verify correct placement of the tube. In order to do that, I would use my stethoscope to skin, use an air bolus with a syringe in this port. Insert a few cc's of air, and with my stethoscope on the skin on the xiphoid process, listen for the air to pass through. Also, an x-ray could verify placement, or using a syringe and the same port, I could aspirate some of the contents and place it onto pH paper to indicate that it was acidic, which means that it would actually truly be stomach contents. And then I would just document the procedure appropriately and make sure my patient was safe, and that would be the end of the procedure.